Assalamualaikum warahmatullahi wabarakatuh. My name is Ihsan Yassin from Microwave Research Institute or MRI in UITM Malaysia. My co-authors are Azlee Zabidi, Megat Amin and Megat Ali, and also Rahimi Baharom from UITM and UMP. Our paper is entitled PSO-Optimized COVID-19 MLP-NARX Mortality Prediction Model. With the current pandemic sweeping the global wide, we are focusing our research on prediction of mortality for the COVID-19 coronavirus. We used the multi-layer perceptron nonlinear autoregressive model with exogenous inputs model optimized using the particle swarm optimization algorithm, and it's nice to say that we have yielded quite an accurate predictive model with a MSE value of 8.1141 to the power of -7. A little bit on the coronavirus itself. The coronavirus was a new virus discovered in 2019, and it belongs to a large family of coronaviruses that is transmissible from animals to humans and also human to human contact. It causes fever and also severe to mild respiratory infections that sometimes result in death. Its origins were believed to be from Wuhan, China, and the first discovered cases were in December 2019. Due to its very effective transmission mechanism, it has spread very widely throughout the world. And in February 2020, the WHO has given, due to the increasing recognition, the WHO has officially given it a name of COVID-19. Because the virus spreads so fast, the effect of COVID-19 has strained public healthcare worldwide. Most governments, I think all of the governments around the world have imposed strict movement mechanisms so that the people do not come into close contact with each other. Despite these measures, some countries were able to control the spread of COVID relatively quickly, while others are still struggling to control this measure. And looking into Malaysia, the first reported COVID-19 infection was on 25th of January 2020. This is believed to be from 3 Chinese nationals who entered Malaysia through Singapore. And from then, the number of cases had begun to rise very significantly. Part of it is due to somewhat a bit ineffective or poorly regulated movement control orders. I remember there was this one case where when COVID-19 was initially spreading towards in the beginning of its when COVID-19 was beginning to spread in Malaysia, there were a few public gatherings that really spread the virus throughout Malaysia. The death rate of COVID varies according to several factors. Age, gender, and pre-existing medical conditions are some of them. Mortality is somewhat difficult to predict, and it is subject to investigation in this paper. Several references have cited that studies on coronavirus death prediction is limited to a few countries. In Malaysia, as far as we know, there hasn't been such a study. So to address this issue, we came up with a COVID-19 mortality prediction algorithm using multi-layer perceptron NARX, nonlinear autoregressive model with exogenous inputs as our model of choice to predict the mortality of COVID-19 cases in Malaysia. There are a few parameters that needs to be optimized for the MLP-NARX algorithm, and to achieve this, we have used the particle swarm optimization algorithm to optimize these 4 parameters for the model. These are some of the works that we have managed to find that are quite related to our research. There have been some work in prediction of COVID cases or mortality, such spread throughout the world. One paper from reference 6 is from Italy, where they used some kind of optimization algorithm to search and define prediction model. A regression method has been used in reference number 8. They tested on it on a few countries. Reference 7 use AI-based technique and a curve fitting model to predict mortality, to forecast infections in US, UK, France, and India. Another AI-based method, this one is using deep learning, was used to predict COVID-19 cases, confirmations, recoveries, and deaths in Australia and Jordan. Several algorithms were tested: profit algorithm, auto-regressive integrated moving average, and also long short-term memory. The results suggest that the profit algorithm was the most accurate, with the accuracy of above 99% for the two countries. Moving on to our methodology, an overview of the methodology is shown in this figure. We started off with data collection. Our data collection was from 24th of January 2020 up until 29th of July 2021. We managed to obtain 553 data points. For the purpose of our model, we extracted two important variables, which were the number of daily COVID cases in Malaysia and also the number of deaths that occurred during that time. Some pre-processing were done to ensure the integrity of the data. Records with missing values were removed. Normalization was done so that the mean is 0 and the standard deviation is 1. And magnitude scaling was performed to scale the upper and lower peaks of the data to between +1 and -1. This is necessary because when we are dealing with neural networks, the tangent sigmoid activation function in the hidden layer, it squashes or limits the value of the input to between -1 and 1 only. So what we need to do is we need to scale the input so that it matches the tangent sigmoid activation function. Moving on to the construction of the MLP-NARX model, there are several optimizable parameters, which are the input layers, input legs, the output legs, and the number of hidden units, together with the initial seed value of the Mersenne twister and the randomization algorithm that generates the initial weights for the neural network. So what we did was we used particle swarm optimization to optimize these four values and to achieve the best model. Optimization, this is the algorithm used for optimization. This is the particle swarm optimization algorithm. Basically, it mimics the behavior of swarming animals, and it has in this particular paper and in many other research as well, it has been shown to perform very well in optimizing a very diverse set of problems, as well as being very light in terms of its computational requirements. This table 2 shows the PSO parameter values that we used, the swarm size and other related parameters as well. The result achieved by PSO was, for our case, the number of input legs is, the optimal value is 12, the number of output legs is 1, the number of hidden units is 26, the seed is 50,702, and the resulting model's accuracy, MSE, is around 8.1141 times 10 to the power of -7. As we can see here, the number of input legs is approximately 2 weeks, which is usually the time frame of the infection for COVID. So it is consistent with what we know about COVID, where it takes around 14 days to incubate inside your body before it really has a very significant effect, harmful effect to your body. So it's consistent. Our discoveries are consistent with what is known about COVID-19 and the way it affects the body. In terms of the prediction results, as you can see, the results are quite matched with the actual prediction. The prediction is the actual values are blue in color, and it overlaps, and the prediction, which is the dotted red line, is consistent with the actual number of deaths in Malaysia. For residual analysis, we wanted to test the residuals whether they are consistent with white or random noise. This is because in system identification theory, the randomness of the residuals play an important part to verify that the model has captured all of the dynamics in the dataset. So we first look at the residuals. Basically, this graph shows the difference between the actual prediction and the actual value and the predicted results. As you can see, in the beginning, there was a very small residual difference between the actual and predicted results. However, as the number of cases grew, we see a much higher residual compared to the earlier stages. So this is because there's a significant increase, and whenever there's a sudden and significant increase like this, we need to the model needs to readjust to the new developments, new changes in the magnitude of the data set. Plotting that the residual above in histogram form, we find that the residuals generally obey the Gaussian distribution, which is good news, because we want the residuals to be randomly distributed. We can see some skewness, a little bit out of shape, but generally it follows the Gaussian distribution. And what we discovered in the autocorrelation and cross-correlation plots was that the results suggest that the residuals are indeed random in nature, with a bit of minor violations here and there, but generally they stay within this blue 95% confidence limit line. So we chose to accept this model, and it has been shown that the model is quite accurate in predicting mortality, COVID-19 mortality in Malaysia. So to summarize, we have constructed a predictive model for COVID-19 using the multi-layer perceptron NARX algorithm model, and optimized using the PSO algorithm. Prediction results were very accurate with acceptable validation results. I would like to thank University Technology Mara for the facilities and funds in support of this research. You can view my references in my paper here. So thank you very much. Assalamualaikum and goodbye. Thank you.